Hi, I'm Dr. Tom Schell with Nouvelle Research and also SecondVet.com. Nouvelle Research, we make the Cur-OST line of herbal formulas for horses. And SecondVet, we've also got herbal formulas for horses, and that's where I do my consulting through as well as outside laboratory testing. So this video here today is one that I just want to make on the state of medicine as it is now. Now, I graduated 30 years ago. It seems like a long time ago. And as I look back, it has been a long journey. And it's interesting to note how medicine has changed quite a bit over time. Now, when I graduated and even before graduating, I did a lot of internships working for veterinarians in high school. I worked in the microbiology lab at the veterinary university prior to even getting into medical or veterinary school. I shadowed a lot of microbiologists, did a lot of laboratory work. So a lot of things were done by hand, and that's the way I was trained before I even got into veterinary school, and that's how I was, trained throughout veterinary school. So we had to use our hands, we had to use our five senses, we had to figure things out, put puzzles together, try to determine exactly what is going on and what is the best course of therapy. And looking at things, things have changed. Attending medical conferences nowadays is a little bit spooky to me because I get to see how much that world of medicine has changed. And it's a little bit concerning to me as a veterinarian. It should be concerning to all of us. And in my consultations, I see it and I feel it. And we try to redirect back to what we were to try to solve problems. And it's a very, very difficult thing to do because the mentality has changed. Now, with that being said, you can see behind me, this is my laboratory as it is here today. I'm not clinically practicing anymore. I do consulting, I do laboratory work. And in this 12 by 12 room that is behind me, and you can see the cabinets behind me, I have all the pharmaceuticals I could possibly need to treat really any case that came into this hospital today, just like I did 25 years ago. I don't require a whole lot, and in this laboratory space here, I can do pretty much anything that an outside laboratory can do, which is interesting to me. But you see, as I reach for things, a typical oto-ophthalmoscope that we would look into eyes and ears with and other body cavities if need be. These things are becoming replaced with technology to where instead of using our eyes to look through this thing, somehow it's communicating with our phones to where we have to see this on a screen instead of using the eye to do it. And I wonder what's going to happen when that phone goes down. Do you know how to use your eyes? I don't know. In the world of glaucoma, these are things that should be probably sent off to the Smithsonian. The world of glaucoma, this is called a Schiatt's tonometer. We would put this on dogs' eyes after a local block to determine what the eye pressures were. This is how we did it before the advent of what's called as a tonopen nowadays. But that's how we measure to determine glaucoma. And then when we look at blood samples, this is, in this case here, is what's called as a hemocytometer slide. We would actually do hand white blood cell counts in our patients. So we weren't sending the samples off to labs all the time. And to be honest with you, when I first set up practice, we didn't really have at our disposal the laboratories that we did. So a lot of this was done by hand, in our own laboratories. So we would take, if we believed that a horse or a dog or a cat had an infection, we would take a sample of their blood, run it through the hemocytometer, look under the microscope, and we could determine what the white blood cell count, the eosinophil count, the basophil count, the lymphocyte count, and we would do all this by hand, tabulating it, calculating it, putting it down on paper, and we could determine whether if there was a septicemia case, whether if there was a left shift, as we would call it, something severe, not severe. We would do a lot of cytologies, aspirating lymph nodes, aspirating tumors on the horses, on the dogs, doing cytologies on various areas of infection, such as abscesses, ears in dogs, any body cavity that we suspected had something going on cytologically. We would sample it, put it out on glass slides, stain it, look at it underneath the microscope. It's extremely interesting to me to see how we have gotten away from this and moved towards technology and the use of outside labs. I'm not against change. I think change is fantastic if we are gaining benefit from it. And what I see nowadays, especially attending veterinary conferences here in the past several years, is that we're losing our ability to be doctors, to be physicians, to be veterinarians. And we're more or less robots, as I have said to some that are getting ready to graduate, both in the human field and veterinary field. You're easily replaced because there's not more that you know than this computer that I'm recording on knows. The average veterinarian or medical student here, as I try to pan around, you can see behind me, whoop, there we go, is my microscope. And then if I go back to the windowsill here behind me, I have all of my stains. So I have what's called as diff quicks and gram stains back there. That's all done by hand. So I can do cultures here in house in my little laboratory here, which we do with fecal cultures. I could do oxidative stress testing behind me. Everything is done here in my lab. It's done by hand. And when I try to inquire with the average veterinary student, medical student that's graduating or has graduated, um, a lot of them don't even know how this microscope works here next to me, or they had a little bit of exposure to it maybe in undergrad, but certainly not any during their medical training or veterinary training. And to me, it's a little bit spooky. It's a little spooky because as veterinarians, as physicians, we're supposed to be scientists. We're supposed to be diagnosticians. We're supposed to ask questions and explore. And nowadays, there's not a whole lot of that going on. We're very quick to think that we see something, and we're very quick to write a prescription. That's very obvious in the world of horses right now with this massive pandemic, if you will, or epidemic of equine metabolic syndrome and insulin resistance and PPID or Cushing's disease. Uh, when I graduated, those problems were there, but nowhere near what they are here today. And so we're very quick to just diagnose that horse, whether if the diagnostic testing is correct in terms of our lab results, remains to be seen. A lot of questions that come up in my mind regarding what we're doing there, but to just think that we have a horse that's PPID or insulin resistance and just start writing these prescriptions for metformin, for Percen the way we do, and not really taking into consideration what those drugs may be doing, what they may not be doing. It's just a different world. But the truth is that you as a horse owner, even in yourself, we do have choices, but we have to recognize that those options are available. I'm not the only cowboy out there in this world that does things by hand. As a colleague of mine said, we're becoming rarities. We're becoming dinosaurs, and this is true. And I am concerned for the future, but it is what it is. But we as horse owners, as veterinarians, as physicians, as people, we can make better choices. We can ask questions. We can inquire. And if the veterinarian that we have chosen is not really up to what we believe could be the best person they could be, or best doctor, even with the physicians, we have a choice. You can choose better. You can start to ask them questions, put them on the griller, instead of them just dictating to you as to what needs to be done. I see this in my consultations with horses and horse owners, and I see what I believe is a state of helplessness, a state of limitedness, that they're on this medication. They don't know why, or the horse is on this medication, I should say, and they don't know why, or they're just doing it because they have testing done, but they have no idea what that testing means. They don't understand why doing an ACTH stim or something along those lines, or even an insulin value, mid-afternoon after the horse has eaten lunch and has been outside grazing on pasture is probably not a good idea, because the results are going to be bogus. But yet we buy into that and we start prescribing medications. So it is what it is. We can do better as people, as horse owners, as doctors. We can do a hell of a lot better. But again, we have to recognize that this exists. And the more technology we draw into it, I'm not against technology, but it has to be providing benefit. And right now, what I see is it's creating more confusion, more helplessness, and more states of limitedness. to where we just don't feel we have any options. And there are tons out there. So if we can help you, please let us know. That's what we're here to do. Thank you and take care.